first thing I'm going to talk about in that regard is some examples about spotting. These are all from England, I'm afraid, but spotting failures in hospital and what's going to happen. This is kind of the last 10, 15 years. Some of these might be familiar to you, some of these might be not, but these are a list of hospitals in England who have all had some kind of serious problem, serious service failure, where probably better use of data would have predicted that, should have predicted that, and in some instances did predict that, but it wasn't acted on. So you can put in all the processes you like, but this is still going on. And I think the challenge for all of us and everyone else in our kind of communities is how can we use data to make this better. One of the first things, people might be familiar with this is really the first time that kind of computing power was such that data could have been used, and this is going back to the late 90s, early 2000s, where we had a children's hospital in Bristol where they were doing actually a very complicated procedure for very ill babies who were born with their heart. I'm not a clinician, I should say, so do correct me if I'm getting wrong. But effectively, these babies were born with their hearts the wrong way round, and the surgeons were doing a very complicated procedure which would turn the baby's heart round. And quite a serious procedure. There is generally, a high risk of things going wrong, but many babies, much more than you expected, would have died because of that. And there was a whistleblower who was an anaesthetist, and he said to the cardiac team and the chief executive of the hospital, I've got some real concerns here, and I've looked at the data, and this is our mortality rate, and here's some other comparable units, and I've got some concerns, will you look into it? And he was absolutely told, absolutely not. These are top quality surgeons, these are very sick babies, nothing to see here, nothing's going wrong. Luckily, he actually had to move to Australia. He was kind of ostracised to the extent that he was handed out the NHS. But he did actually keep his campaign going. And eventually, I actually used to work for this guy. Sir Ian Kennedy led the first kind of big public inquiry into hospital failures in kind of 2002, 2003. And he found, unsurprisingly, that they weren't doing the operation. There was two kind of problems. There's number one, the actual, story, the document, the actual surgeon in question, unfortunately, wasn't competent. He didn't know how to do the operation. And number two, there was a specific structural problem, which is this is now the new children's hospital that was built in the wake of it. But that children's hospital was at the bottom of a hill, and I don't know if anyone's been to Bristol, it's very hilly, and the intensive care unit was at the top of a hill. So once they'd finished operating on the babies, they had to put them in an ambulance, as it were, and drive them up the hill to the ITU and then continue caring for them there. And that kind of couldn't be more than 1 minute, 2 minutes, had kind of compromised the care, as it were, and that was also leading to the high mortality rate. So you had a problem with outcomes, I suppose, and the surgeon, unfortunately, didn't know how to do the procedure that he was being licensed to do, and you had a structural problem with the A&E. So they've rebuilt it all. But it's something that could have been predicted. So I'm sure most of you are familiar with these types of things that we call funnel plots. So the line in the middle at 25% is the average. These kind of curves going there are some kind of different kind of confidence thresholds, and really you want your data to be in the middle. On the right, you can find this is the analysis that was done kind of by Imperial College London, totally independently from the inquiry, and you can see that the Bristol here, the one at the top, is kind of a total outlier outside the red line. All those other dots are the other kind of comparable units in England, and that kind of, you would think, proved comprehensively there was a problem there. On the left, you can see those dots are exactly in the same place, but the people in Bristol who didn't want to kind of admit there was a problem commissioned some other analysis. Those dots are in the same place, the absolute values, but they've said actually we think the unit was performing okay, we think we were inside the threshold. So it's a contentious area, but I think the inquiry kind of borne out that there was actually a problem. So after that, something kind of pretty important happened. So this is Alan Milburn, who was the Secretary of State at the time under New Labour, you probably know them, and he made this really important quote, which is, the days when the NHS can act as a secret society has gone. And what he meant about that was that we had, and this was borne out in the inquiry, we had all this data flying around the system. We also had people, and I'm sorry to say that was mainly doctors, who knew whether the hospitals where they worked were any good, knew whether their colleagues were any good, and no one else knew about it, not least all of us, the people who were consuming healthcare. So he took steps to make the data available to lots of different people, including an organisation I used to work